So this is a prone thoracic adjustment. What does that mean? Well, patient prone, lying face down. We're going to push on this patient's T6-7 vertebra, which is stuck, not moving. When joints stick together, it interferes with the neurology in that area. And this adjustment is to open up those joints. Take a breath in. Let it out.
Oh, yeah.
So multiple segments moved there, probably 3 vertebrae, where the ribs attach moved as well. All those joints would open up, and that basically wakes up the nerve receptors in this area, communicates that to the brain. We get relaxation, right?
Mm-hmm.
Relaxation, better movement, power's on.